NorthernThai Massage video with Pichest Boonthumme. Lean forward, palm press, base of the arch to middle of the arch to tip of the arch. Elbows straight, use your body weight. Let your body simply be where the energy comes from, just as a conduit. Then come up into a squat and lean forward from body center. Let your elbows be supported with your thighs. Turn your knees out. Follow the 5 energy lines on the bottom of the foot from base point at center of the base of the arch at the ball of the heel. Follow the line out towards each toe with several presses, then a circle, a big circle on the knuckle, and slide off the toe. Follow for each of the energy lines. Pressure is deeper at base point and lighter squeezes as you move your way out. Make it easy to do. Keep your body in alignment and breathe. Bring your knees to the floor. Curve of the knee fits the sole of the foot and big sloppy circles on the top of the foot. Let the flats of the tips of your fingers circle across the tendons and notice the quality of those tendons. This helps stimulate the flow of energy in the lines on the outsides of the legs and gives you indications of what the condition of the outsides of the legs will be like. Then move to the right foot, squeeze towards the center of the foot from the sides, firm to medium to light, firm to medium to light, and then lift, cradle, and big sloppy rotations. Move the heel at the same time so the rotation reaches well into the ankle joint. Then for twisting, reach over. No need to pull towards yourself for traction. Simply twist to relax the foot. Allow the bone structure to roll in the hip joint all the way up through the femur. Then each toe, circle and pull. Allow that to stimulate the flow of energy out through the meridian, which passes all the way out through each toe. For stretching the foot, hands come together and notice the knee just barely lifts at the range of each press. That's plenty of pressure when the knee just begins to lift. And then squeeze and flick the foot several times to relax. Let the heel come off the floor. Move to the other side and squeeze sides of the foot towards the center. Squeeze, squeeze, squeeze. And again, bring the foot up. Use your thigh for support for your forearm. Big sloppy circles. Move the joints of the feet, not just the ankles, so the toes move along with you. And then twist. Start from low in the arch close to the heel and work your way out. Opposite side, reach over, and simply allow this pressure to rotate the leg in the hip joint. Then each toe from a circle to a pull. If the joints pop, it's because the energy or lom or wind is moved. And then twin palm presses top of the foot. Keep good ankle alignment during twin presses. And then flick and relax the foot. Breathe. Turn the foot out, reach into the calf, and from tip of the arch and low calf to middle of the arch to middle calf, and then close to the heel and upper calf. Just allow your body weight to be over your hands. When you go to move up the leg, step your knee between the knees, come up, invert your right hand, left hand on quads. Lean forward. Let your pressure be in towards the center of the body part, and then gently relax. Loop down the inside of the leg. Come in again, and go. Lean up the body to increase pressure if appropriate. Lean back, gently relax, come up again, Each time, notice that we don't deflect the muscle substantially and we leave our pressure towards the center of the body part. And warm the lower leg again in preparation for the lines. Take care of yourself. Just peel the muscle gently away from the bone. Start behind the malleolus. Thumb the inside line. Let your thumb slide along and between the quads and the adductors. And return. Flat of the thumb, not the point of the thumb. Allow your thumb to be a broad surface area. And then squeeze twin thumbs on the Achilles tendon. Follow the line halfway between most medial and most posterior line. And then follow adductors all the way up to adductor tendon or gracilis and return. Let your thumb be broad and flat, close to the joint. And then twin thumbs squeeze. Circles to relax. And retreat. Face up the body. And lean up body to press anterior tibialis. Elbow locked. Peel the muscle. Focus the energy in such a way that the ankle is not getting twisted, but there is a stretch. Stretch the toes towards the floor enough that anterior tibialis is under a partial stretch during presses. Come around, spread knees, and palm press lateral leg. Work your way up at about a 45-degree angle with your arms. Press towards the center of the leg. Don't let your heels of your hands drift too far down to the lateral side of the leg so you don't tweak your wrists. Rock from side to side. Elbows stay straight. Sit low. Warming. Sensing. Checking. This warms the leg up to prepare for the energy lines, which starts with twin thumbs at lower leg. After warming, face up the body, warm the lower leg again. From this position, let's remember to stay over our wrist with our body weight. Gravity is our friend. And twin thumbs after touching the wind gate. 3 presses, just about 1 thumb distance lateral of the tibia. And then to alternating thumbs along the valley between lateral quad and ITB, or along edge of lateral quad. And again, twin thumbs, 3 presses, and 2, and 1. And wind gate briefly, touch behind malleolus, and on fibula, alternate thumb walking, flat of the thumb, right at the joint on the bone, and then gently on iliotibial band. The bone is very close to the surface. The muscle is thin. Let your pressure be just appropriate to avoid creating a defensive reaction in the client. And breathe. And circles. Come around the corner. Warm the lower leg. Once again, invert the right hand and left. And stay over your palms. Body weight. Regulate the pressure on the foot so it's not too great out near the toes. Just warming, checking, sensing. Come around, bring your knee between the knees. Lean up body directly towards the center of the body part. And then sit back and loop to return. Gentle palm walking. Warming. And come in again. Start the loop again. Lean forward enough to be past dead center. Allow your weight to rest. And then come back and return. And continue again. 1, and 2, and 3. Return. Thumb lines after warming low leg again. Gentle. And breathe. Take care of yourself. First line, behind malleolus. Thumbs are nice and flat, not too pointy. And slide each time. Avoid the tendency to lift off and be jumping. Skip over the knee. And behind malleolus, squeeze the Achilles tendon with both thumbs and at a 45-degree angle on the calf and into the adductors. Take care of yourself. No need to overdo. Energy lines, the pressure is not too deep. Circles. Retreat and face up the body and warm up the lower lateral leg. Again, align the ankle. Slight medial rotation. Lean up body to apply pressure. Let gravity be your friend. Simply warm up the area. Checking, sensing, and breathe. Adjust your pressure on the thinner areas, increase your pressure on the thicker areas. Spread your knees and rock from side to side to apply pressure. Elbows are straight. Heel of the hand just on lateral quad and anterior tibialis. Warming, checking. Sit low, stay low. Touch the wind gate after warming again on anterior tibialis. Peel the muscle away from the tibia. And touch wind gate and begin. Twin thumb presses. Take care of yourself. Both hands so close together it's easy to cross the thumbs at the first joint. Then from here, individual thumb walk. Just the lateral edge of the lateral quad. And return. And to twin thumb presses on the anterior tibialis. And rock, and rock, and rock. Let your body sit low, reach behind the malleolus and flat of the thumb, along the fibula, and up lateral most line on the iliotibial band, and down the fibula, directly on the bone. Touch behind the malleolus, and circles. Draw the knee towards you. Palm walk inside the arch and inside the calf. Checking, warming. Stay up off of your heels enough to easily be over your wrists, directly over the area. And then transition, peel the quads. Don't overdo inside the space between the quads and the adductors. Stay on the quads. And then twin palm presses. Exhale. 1 and 2, 3. Move all the way to the joint. Stretch the hip and return. Close to the pelvis. 1 palm distance. And go. Return. Let yourself come past straight up and down in order to provide some traction away from the pelvis. And then warm the lower leg again. Palm walk. Warming, checking, relax. Then to prepare to push the back of the thigh with your feet, first move the foot outside, sit on left flank, come inside, right foot behind the knee, and bring thigh up to 90 degrees to center line of the body. From here, each time, bring your knee to lock, and then lean back. Just the lower half of the thigh will be worked with your first foot. Keep your toes towards you so your toe isn't pointed away from you to slide or cause skin burn. Then park your toes behind the knee for the lock. Fold the ankle to the inside and tuck the toes behind your calf. Reach out with your left heel close to sits bone and begin at upper thigh. And work your way with edge of foot. In this more dense muscle area, edge of foot has greater penetration, more therapeutic. Each time recognize that as you lock your knee, it's effortless, easy to do, nothing to do. And breathe. Cross over to a double lock. As you lean back, draw the quads towards you. Use your body weight. Your foot can press gently into the back of the hamstring. And then, when completed, stand the knee up. Come forward a bit if you need to. Alternating hand pulls on the quads. Checking, warming. And then heel closer to sits bone, twin hands interlaced for quad pulls to stretch through hip and into the torso. Lean back, use your body as a counterweight. Bring the heel out, cross the knee over, and use your thumb in the groove behind the iliotibial band. Then to reach the back of the calf, when you stand the knee up, let your fingertips reach directly into the center line at the back of the calf. Some people will be very sensitive, so respect that, depending on their tolerance. This stimulates the flow of energy. And then lift the heel to extend the ankle joint several times. Slip your fingertips under it. Push the knee at the same time as you lift the heel. Easy to do. Lift the heel all the way up. Bring your outside foot, your right foot, behind the knee. Drop the ankle and lean back with the locked knee. Move a very small amount down, or in other words, away from the knee along the thigh in several presses. Not more than the midline or middle distance between sits bone and back of the knee. And then foot on floor, sole of foot against back of thigh, lean back. Traction. Let your toes draw towards you. Avoid any tendency to point your toes or jab them into the thigh muscle. Let your body be a counterweight. Push the knee up, turn the foot outside. Come up on your knees. And outside hand presses the quads. If you need a bolster, depending on the flexibility of your client, or placing your knee under their knee, can protect clients who are stiff and have less range of motion. Twin hand presses, they'll be offset for twin hand presses. Lift the knee to free the foot, and put the foot in your low belly. Step up into a lunge just outside the hip. As you lunge forward, left hand at inner thigh. First to 12 o'clock, then 1 o'clock or 2 o'clock. Work your way out towards 3 o'clock. Use your body weight. It is not necessary to use your strength. Come around, twin hand presses. Let the foot remain in your low belly. And 2, and 3, and 2, and 1. Turn, and set up for hamstring stretch. Bring your outside knee to support hamstring origins as you draw heel up and away. Move up the thigh to continue to support the hamstrings for the repeat stretches. Each time bring the heel towards you before you begin again. Turn and bring your left knee up, cup the ball of the heel, stretch the Achilles tendon, gently support the knee, don't hyperextend the knee, take care. And then with leg on the ground, circles. And opposite side, come around. Walk the inside of the arch and inside of the calf. Let this energy begin to move through this warming, checking, warming, checking. Pressure does not need to be super deep. Stay over your wrists. Body weight is positioned over your wrists. And then calf and quads. And return, calf and quads. Each time, take care not to press into the nerves between the adductors and the quads. Then twin hand presses. Deep pressure on first 2 presses. Gently on the joint. Return. Let your breath move. Just warming, stretching, checking, and then warm the lower leg. Just let your hands press and warm. Once again, we'll open the foot out in order to bring our body inside. Sit on your right flank. Bring your left heel behind the knee. Face up the body. And with your heel behind the knee, go to your knee is straight. Make sure thigh is at least at 90 degrees to the center line of the body. If you sit too far away from your client, the thigh will not reach 90 degrees to the center line of the body. Then you need to move up in order to have a good platform for your pressure, to avoid skin burn. Lock your knee each time, then lean back to apply pressure. For a lock, tips of the toes just behind the knee, and right heel close to the pelvis. Let the energy be facilitated to a greater degree. Use the edge of the foot. Each time, let your knee lock. Easy to do. Nothing to do. Gently cup the ball of the heel with your left hand. You can draw with the left foot to improve the pressure. Don't overdo at midpoint. And then left foot behind the hamstrings. Draw the quads. Nice spiral. Let the knee move. Both hands, rather than clawing, are flat and fit the shape of the quads. Reach around as far as you comfortably can. Then bring the knee up for alternate hand walking on the quads. Warming, checking, warming, checking. Pressure is very light and brisk. Then interlace your fingers And as you lean back, use your body as a counterweight to allow the stretch. Heel closer to sits bone and go. And 2. And 3. And 2. And 1. Let the heel scoot out a bit, cross the knee over, let your thumb reach behind the iliotibial band in the line. Follow the energy line from just behind the knee up to just behind the trochanter. A couple or 3 passes for warming and checking. A little bit of squeezing with the fingers is fine. When you bring the knee up, use your fingers in the center line of the back of the calf. Just enough pressure to stimulate the flow of energy, or lom. And then heel hopping. Extend the ankle completely on each hop. Once again, to stimulate the flow of energy. Push the knee at the same time. Make it easy to do. Then push knee, lift heel, and left foot behind the knee. Lean back, knee locked, and pressure. Small amount of movement with each of the presses, only to mid-thigh at the maximum. Then when you bring your foot to the floor, scoot back enough that your left knee will be completely straight and the sole of the foot fits the sits bone and back of the thigh. From there, when you lean back, allow your toes to travel towards you. Allow your your ankle to articulate. Allow the client to be pulled towards you just a bit. Then when you turn the foot out, come up on your knees. Support the knee as much as needed. Lean forward. Peel the quad muscles. Really good for lateral quad. The muscle is on stretch, so the response is increased when the muscle is on stretch. No need to overdo. Pressure can be regulated easily by how much you move your body. And breathe. Lift the knee. Tuck the foot inside your pelvic bone structure. Step up in a lunge. And as you lunge forward, right hand inside the thigh. Up towards 12 o'clock. Out towards 11 o'clock. Continue in the same direction. 10 o'clock. Work out towards 9. Eventually end out close to 90 degrees to center line of the body. And then rotate. And twin palms. Butterfly palms at inner upper thigh. And mid-thigh. Exhale. And 3. And 2. And 1. And turn. Knees come together. And support hamstrings. And go. Heel up and away. Knee comes up away from origins. Go again. Return. Just warm the back of the thigh. Checking. Warming. Not overdo. And then knees to the floor. Bring up your right knee. And cup the ball of the heel and lean your body weight. Stretch the calf. Stretch Achilles tendon. Resist the temptation to press with left hand. No need to overextend the left knee or right knee. Circles and relax. Side lying position. Face up the body. Place your right knee in the arch. Left hand on the calf. Peel the calf muscle as you bring body weight onto your knee in the arch of the foot. Regulate your pressure by how much weight you leave on your right hand and also on left knee as needed. Breathe. Come around to face lower leg and face down body. Invert the right hand. Palm walk the leg. Low calf, low thigh, most inner line. Mid calf, mid thigh. Upper calf, upper thigh. And loop down the back side of the leg. Gently relax the back of the leg. Work your way down. And invert. Face down body, come up. And use your breath. Exhale. And again, invert. Keep your weight over your hands. Give yourself a nice yoga stretch in the process. And return. We thumb the most medial line. Alternate thumb walk. Slide. Skip over the knee. Follow adductors. At the top, you can give an extra press with supported thumbs. Take care of yourself. And return. And down the calf. Thumbs point towards each other. Then squeeze twin thumbs on Achilles tendon, most posterior line on the calf. And also follow medial hamstring to sits bone. Also, when close to sits bone, you can do another supported thumb press if you wish. And take care of yourself. Protect yourself as you stack your thumbs to protect each other. Work your way back down. Stay over your thumbs, gentle pressure. And for blood stop, draw the leg towards you, turn, and sit at most medial, highest point closest to sits bone, and allow your body weight to rest directly over the client. Sit still, very, very still, no wobble. Impede the flow of blood through femoral artery, then move just a bit. This is accelerated a bit for this video. You can stay anywhere from 30 seconds to 1 minute or even longer on each of the sits if needed to help a person get the energy moving. Here, this jump starts the energy down through the yin channel on the inside of the leg. And then you can return to point number 1. And let the blood move. That means release slowly each time. Don't lift off too quickly. Once the blood is moving, the energy will also be stimulated to move. We recruit the systems of the body to assist us in the healing process. Turn and drop. Step and walk low leg and lateral foot. Don't crush the foot too much, but place plenty of pressure on the fibula. It is good to flex this bone structure. It's good for the interosseous membrane between the tibia and the fibula. This is the most lateral line, most yang. We stimulate the flow of energy. We help prevent osteoporosis through this flexing of the bone structure. Drop right knee and walk fibula and lateral quad. Avoid the tendency to crush the ITB. Iliotibial band is very thin and directly over the bone. Too much pressure there can cause the client to jump. Nice steady rhythm. Shoulders over your hands. For extra therapy, give yourself a lunge so you get yoga benefit. Same time, press into lateral quads with deep focus. Let your body weight come through your joints. Keep your elbow locked. Take care of yourself. And for more focus, just warm the energy up at lower leg. Palming. Relax. Checking and breathe. Thumb the line behind the fibula and behind the iliotibial band. Turn your body, make it easy to reach. and return. Second line, squeeze the Achilles tendon. Work your way up the back of the calf, center of the back of the hamstrings. Return down the back of the hamstrings and back of the calf. Turn to face up the body. Right heel behind the knee. Lock your knee and lean back to apply pressure. And mid-thigh. Remember, you don't need to use the ball of the foot close to the toes. Arch and heel are best shape. No need to point your toes, as this will cause skin burn. And tuck your toes behind the knee. Get your lock. Foot locked inside, cup the heel, and your foot close to sits bone. And bring your foot along towards mid-thigh. Edge of foot provides greater penetration, more pressure, and more therapy to the degree that it is comfortable and acceptable to the client. For extra therapy, Achilles tendon between big toe and index toe, and pull the quads. Twin hands. Hands are stacked. Hands are curved to match the shape of the muscle structure for traction. Then when you're ready to use the knee, change your position and gentle pressure into the hamstrings at the same time. No need to overdo. The knee is broad and rounded. It's a good shape. Facilitate the rotation of the muscles around the leg. And then, if you wish to go to spinal rotation, again, adjust leg, allow some travel, allow some movement. Gentle presses on lateral thigh. And return. Move around the back. And QL, quadratus lumborum, at the most lateral edge with your thumb. If your thumb is not strong like Pichest, stack your thumbs upon each other to protect your thumb. Don't overdo. Move towards the spine in 3 presses. 1, 2, 3, 2, 1. Each time, observe the sensitivity of the client. Notice as you palpate how the quality is of this area. And then thumbs in the lamina groove. Work your way up the spine. As you work your way up the spine and down the spine, let your thumbs be flat. Pressure does not need to be deep. Let's recognize that we stimulate the flow of energy. We're warming, checking, warming, checking. It's all about gentle pressure, not needing to be deep. Then, twin thumbs press laterally at the edge of erector spinae towards the center. There's a nice little groove at the edge of that muscle structure. Do not allow the muscles to slip underneath your thumbs. Traction them towards the spine. Pressure is firm, but not too deep, and is towards the spine rather than down towards the floor. If you're going to use your knee in the lumbar, make sure you keep a lot of weight in your hands to regulate pressure so the pressure is not too deep and not on bone structures. You want to clear bone structures so your knee is not on floating rib in particular, which is a sensitive structure, and we don't want to dislodge or damage the floating rib. It's a very close little window between the iliac crest and the ribs. Place your knee very carefully if you're going to do this. Be sensitive. Therapy is improved through raising the arm. Regulate your weight. Pichest is really good at this. Consider that this takes practice. I don't recommend that a big therapist try this on a tiny client the very first time. Okay. And then retreat and stimulate the flow of energy. Thumbs point towards each other. Allow the muscle to slip under your thumbs with a rapid movement. This is somewhat irritating to some clients, but it does stimulate the flow of energy. This is therapeutic for energy movement. Then on the opposite side of the spine, work towards the spine. Similar movement. Draw and allow the muscle to slip with a rapid pop underneath the thumbs to stimulate the flow of energy, and then double your hands to squeeze lumbar at the most lateral edges of the quadratus lumborum. Stack your thumbs to protect yourself. Make it easy to do. Fingers very, very close to each other, stacked upon each other slightly to facilitate these squeezes. This is just to relax the back. Notice and observe how is the balance across the lumbar region. Then adjust alignment and use the client's body to support you as you bring knee into lumbar on opposite side. Again, not full body weight. Stay away from floating rib. Avoid bone structures. Just enough pressure so the client is not prompted to stimulate a defensive reaction. When you move up, the back pressure is much, much lighter. Be very cautious as you move up onto rib cage, if you're going to do that at all. Your knee is a good shape. Some people's space is very, very close and very small between the crest of the ilium and the rib cage. Bring client back into position. Fold wrist behind the lumbar. Push shoulder away from you somewhat to open the space, and then draw shoulder towards you. No need to push with the thumb at all. Here, what's happening is it's the mobilization of the shoulder which creates the pressure that allows the thumb to travel into the space between the scapula and the ribs. When you switch hands, again, place your thumb halfway between scapula and spine. Allow the scapula to travel over the thumb. You need the elasticity of the spine to allow that penetration. Draw the shoulder. Let your fingers drop into the cleft between the humerus and the ribs on the anterior side. Switch back and go again. As you draw, let your thumb be stable. Let the pressure come from pulling the shoulder towards you. Be good to your thumb. Don't overdo. Don't risk any pressure which causes any pain in your thumb at any time. Allow this pressure to open the space between the scapula and the ribs. Now for arm presses, face down the body on one knee. Allow your pressure to be between the radius and the ulna with inverted hand on the forearm. Let your upper hand be directly over the bone structure on the humerus of the upper arm. Keep your elbows reasonably straight during pressure. Then, when thumbing the line, stay on the most centered line between the radius and ulna and directly over the humerus, all the way up between the deltoids. Thumbs are flat, not pointed. Broad surface area. Pressure is not too strong. Then when you roll the arm, let your thumbs be flat and use a clamping motion. Fingers pull just enough to allow the flat of the thumb to ride on the energy line. Work your way up, all the way to the notch in the shoulder and return, all the way down. Squeeze. Twin thumb squeezes are a really good feeling. If you have time in your session to apply this pressure, it's a really good feeling. Turn to face up the body. Interlace your fingers. Let your thumbs press from the heel of the hand in 3 lines towards little finger and thumb first, is the first pair of lines. Second pair of lines is towards ring finger and index finger. Third line down the center line of the palm towards the middle finger. Let your body weight apply the pressure. Open the hand. Support with your fingertips on the back of the hand. Take care of yourself. No need to overdo. Then, fingers in the webs. Let the tips of your fingers just be very, very close to the knuckles. A little stretch. And then individual, each finger circle and pull. Yeah, circle first and then pull. Each time, support the hand with your other hand. And then, of course, the thumb also. Be gentle with the thumb if need be, depending on the client. Then circles and squeezes all the way down each finger. Firm pressure all the way down to the nail bed on each and every finger. Then stretch each finger back. Support the back of the hand as you do so. Include the thumb. And then bring arm forward and swing back and palm press at pectoralis and anterior deltoid. First press in the space between the humerus and the rib cage and work your way carefully, not too much onto the arm, just enough to be tolerable, still on soft tissue. Support the arm with your left hand. Just do the presses. Elbow straight, lean your body. Then as you bring arm overhead, step up body and invert your right hand onto lateral application onto posterior deltoid and lateral scapula. Mostly on arm is where this energy is focused. You can go to lateral scapula. If so, do the pressure lightly. Support the wrist with your other hand. Then as you pivot the arm, turn to face up the body. Put the wrist in front of your knee and thumb walk most inner line from armpit out between biceps and triceps and on flexor muscles all the way to the wrist. Thumbs are flat, not pointed. All the way up into the axilla. Then, when you bring the wrist in against your body after repeating this line, you will reach over and clasp your hands over the top of the shoulder, and when you lean back, the stretch will draw shoulder directly towards the hip without posterior movement. Allow this stretch to reach into the upper traps and into the scalenes. Simply move your hands a tiny bit each time. Let the head lift slightly. It's not a large amount of movement in terms of this stretch. Use your body weight. And then in preparation for the foot behind the scapula, rotate your foot to match the angle of the medial border of the scapula. And as you draw back, make sure your toes do not jab into the ribs. We want our toes to ride up into the space between shoulder blade and the ribs. As we draw, we allow the body to come towards us instead of pushing away. Move down along the body if you need to improve the ergonomics, to improve the motion, and to relieve the stretch on the front of the shoulder in the client. Then left foot is very, very light as right heel reaches to peel quadratus lumborum. Release and stretch, release and stretch. No need to keep the hand drawn back all the time. Can be too much for pectoralis and anterior deltoid. So release a little each time. Come up. Rotate the wrist in front of your knee for spinal rotation. And exhale with each application. 1, 2, 3, and 2. Let's go ahead and park that arm above the inferior arm. Collapse the body somewhat, bend the lower leg, draw the thigh out, and gently anchor the sacrum and lift to stretch into quads and psoas muscle, then to the lumbar, and then just above lumbar. Gentle foot pressure just to isolate the stretch. No need for big pressure. The foot is very, very light. Then, as we turn, square up the thigh, step behind the thigh, left foot and ankle behind the sacrum, and first pull through to prepare, and then into a nice spinal twist with lift. Also, this is a lateral stretch. And release. And client turns to other side of body. Come around, face down body, palm the inner thigh and calf. First start by warming sole of foot and peel calf muscle. Support yourself with your hand to prevent too much weight to come onto calf or sole of foot. Let your body rock forward to apply the pressure. Peel the muscle. Breathe. Turn to face the leg, then down body, invert left hand, peel calf, and palm press inner line, most inner line of the thigh. And then loop to return down the back of the leg, turn, and gently relax medial hamstring, back of calf. Then turn to come up the body, invert the wrist, peel the muscle, turn to face the body, loop the energy. Breathe. Give yourself a yoga stretch in the process. Shoulders over your hands. Again, relax. For thumbing, most medial line. Start behind the malleolus and follow and along adductors. Twin thumb press. Protect yourself. Stack those thumbs. Return. Be good to yourself. No need for deep, deep pressure. Stimulate the flow of energy. This is not about the specific points in most cases. It's primarily about the overall movement through the energy channel. Follow the medial hamstring to sits bone. Again, if you wish a twin press, close to bone structure at origin of muscle, return. Thumbs are flat, not pointy. Pressure is close to the joint of the thumb. And then twin thumb press at Achilles tendon. Turn after setting alignment. Face down body. Allow your weight to be centered. And again, here we use left flank second time. Impede the flow of blood through the femoral artery. Each time you move, allow the blood to flow down through the yin channel. Recruit the circulatory system to be your helper, to assist this person with energy movement through the yin channel. Each of these sits can be 30 seconds to 60 seconds or longer. Be good to yourself, no wobble. Nice and still, nice and stable. Adjust pressure as needed. Keep pressure away from knee joint structure. It's important not to be too bony or pointy when close to the knee. Deeper pressure higher up the thigh. After the sits are complete, allow the blood to move and turn and reposition the lateral leg and start warming lateral foot and fibula. Pressure on the foot is reasonably gentle. Pressure on the fibula is firm. Allow the bone structure to move or be flexed under your pressure. Helps prevent osteoporosis and also has a great effect on the interosseous membrane between the tibia and the fibula. Turn, drop your knee, and walk up the lateral leg. Open your hand to distribute the pressure on lateral leg to avoid excessive pressure on the iliotibial band. The muscle is thin and the bone is close to the surface. Pressure can be sensitive here. When you're ready for thumb pressure, first let's do some advanced therapy. This is optional. Go into a lunge, give yourself a yoga stretch. Heel of the hand on lateral quads. Stabilize the thigh. Protect your wrist. Take care of yourself. Allow yourself to come into alignment so the pressure is directly towards the center of the body part. Then if you're going to do more optional therapy, when you bring the foot out, make sure that you can tolerate having the Achilles tendon between the big toe and index toe. Pichest can do things with his body. He's used to doing these things. He's been doing this for lifetimes. Take care of yourself when you try to do ambitious moves. Let's work our way up the groove, behind the fibula, behind the iliotibial band. Turn to face the area which is being worked so you don't have to twist to reach around the corner. And then spin your body again to come down, same line. Then stack your thumbs, twin thumb press on Achilles tendon, follow the back of the calf, alternate thumb walking, center of the back of the hamstring all the way to the sits bone. Turn to face the line, return down, and again turn to face back of the calf. And twin thumb squeeze on Achilles tendon. Sit down. Bring your heel behind the knee. And here, lean back to apply pressure. Knee is locked. Simply work the lower portion of the thigh on the initial presses. Allow your body weight to apply the pressure. And breathe. Tuck the tips of your toes behind the knee to get your lock. Cup the ball of the heel. Bring your right heel close to sits bone at the origins of the hamstrings. And if greater pressure is needed, allow the edge of the foot to reach. Edge of the foot reaches into the hamstrings. Nice penetration. This is deeper therapy this way. Be mindful. You can draw a little bit with the left foot as right foot reaches into the hamstrings. Be conscious of what your client can tolerate, particularly at mid-thigh. Some people, particularly athletic people, have a great sensitivity at a point at exactly midpoint of hamstrings. Then as you move out, take care of yourself. Just enough pressure on the quads to rotate muscles around the femur. Allow the skin to move. Then when you bring your knee into position, come up onto your toes so that as pressure is placed, the pressure of the knee is rounded and soft. Okay. Then separate your hands. Use your breath. Breathe with your client. And if you're going to do this spinal twist, be conscious of what your client can tolerate. Take care of yourself as well. Gentle palm presses on lateral leg. No need to overdo. It's a very advanced posture. Just do what you can do. No need to be too ambitious. And then around to quadratus lumborum. Stack your thumbs to protect your thumb if you need to. Start at most lateral edge of quadratus lumborum. Move in presses towards the erectors and return. This is just to stimulate flow of energy. No need to be too deep. Some clients will be very sensitive, particularly at the lateral edge of quadratus lumborum. Then thumbs are flat, not pointy, as we come up lamina groove. Checking, warming, no need for deep pressure. Keep your elbows straight. Allow this pressure to come from your body center. And let the energy move. Stimulate the flow of energy. Then twin thumbs, press on lateral edge of erector spinae muscle, press towards spine. Bring the skin along with you. Don't let the muscle slip under the tips of your thumbs. See how the hands fit the shape of the back? Allow your hands to open. Full contact. Broad contact. Then if you're going to use your knee, remember, let your body weight be supported by your hands. Knee pressure does not need to be too great. Gentle application of pressure. Some people can't tolerate this pressure at all. This is not peeling the muscle. This is pressing on lateral border of quadratus lumborum. Be careful on floating rib. Do not dislodge the floating rib. This is an advanced posture. Then as you move into your next phase, here we allow the muscle to pop underneath the surface of the thumbs to stimulate the flow of energy. Once again, this can be irritating to some clients, but it does not need to last long. Allow this to be the type of pressure which simply and we're in side lying position. Thumbs move over the muscle. Let the muscle slip underneath the thumbs with a brisk movement. Stimulate the energy flow through the meridian. And squeeze. Let the thumbs and fingers overlap each other in order to support. Makes it easier to do this squeeze so you don't stress your own body. Pressure is gentle. Just sense, warming, checking, sensing. Correct body position and use your hands for support. Stay away from bone structure. First presses towards the spine. Allow this pressure to be regulated by how much weight you keep on your feet, how much weight you keep on your hands. Move deliberately, stay away from floating ribs, and breathe. Bring the wrist behind the back for shoulder routine. Support your thumb and draw the shoulder. Draw the shoulder. Thumb is stable. Shoulder travels across the rib cage towards you. Take care of your thumb. Don't risk stress on your thumb. If it doesn't feel good, reduce the pressure or look at alignment. Let your joints be aligned. And breathe. Elbow is supported again on the leg. Let the fingers of your hand in the front reach into the cleft between the humerus and the rib cage. Wrist on the hip, come up, face down the body, palm presses on the lateral arm. Take care of yourself. Give yourself some yoga stretch. Warming, checking, sensing. For thumb lines, right down the center of the most outside line. Pressure is firm but not deep, not necessary to work hard. Easy to do, nothing to do. Then when you invert the hand, let your hands clamp. Let your thumbs be flat. No need to use the point of the thumb. And if you want to do extra presses in the forearm, twin thumbs are fine. On the flexor muscles, yes. Good feeling. Good feeling. Then when you move to the hand routine, interlace your fingers so that your smallest fingers go between the two smallest fingers, then one finger between index and middle, and two fingers between index and thumb. Let your thumbs press into the lines on the palm of the hand. Use body weight. Take care of yourself. Use your fingers on the back of the hand to open the hand, to stretch the hand open to receive these presses. And fingertips just between the knuckles, just in the webs. Gentle pressure. And then each finger, circle and pull. Support the hand with your other hand. And then circles and squeeze. Firm pressure down over each of the fingers. All the way to the nail bed from the knuckle. Relax those fingers. Stimulate the flow of energy out through those meridians, which extend all the way out through the fingertips. Then stretch the fingers back. Support the back of the hand during these stretches. And then fingers interlace, sweep the arm frontwards, support that arm, and bring your left hand into pectoral muscle and anterior deltoid. Bring your body above your hand, allow the pressure to be just body weight. Stand on one knee. Easy to do. And then when the arm extends over the head, support the wrist, and your forearm can rest on your knee. Make it easy to do. And then invert left hand and press on lateral shoulder up onto deltoid and somewhat of the scapula as well. When you sweep the arm back around, support the wrist with your knee and use your thumbs. Start in the axilla, work your way out on the most inner line. Thumbs are flat. Firm squeezes in the flexor muscles, gentle in upper arm, not too deep. Then when you bring the wrist in close to your body and interlace your fingers over the shoulder, when you lean, draw that shoulder towards the hip to stretch the upper traps and the scalene muscles on the side of the neck. Pressure is firm but gentle, not super strong. As soon as the head begins to lift a little, you're there, you're doing fine. Then, when you bring your foot into the space between the scapula and the spine, angle your toes down the body to match the angle of the medial border of the scapula. Keep your toes soft. Allow your ankle to articulate so that as you draw the client towards you, your toes do not push into the ribs. Jamming into the ribs is not a good feeling. What we want the toes to do is to ride up into the space between the scapula and the ribs. Then relax that foot and reach with the ball of the heel to peel the quadratus lumborum away from the spine. If you're going to work up onto the ribs at all, be sure to be soft, not too deep. Take care to release the arm after each pull in order to allow the shoulder to relax in between all these pulls. If someone really has shoulder trouble, you may have to develop modifications. And then, coming up, rotation, inhale please, and 1, 2, and 3, 2, 1. From here, park the arm above the inferior arm, reach down, bend the inferior leg, draw the thigh towards you. As you stand up, anchor the sacrum gently. As you lift, simply just enough to apply the stretch up into abdominals. The upper foot simply isolates the stretch. And then release. And reposition the body. Thigh at 90 degrees, step behind the thigh, your ankle behind the sacrum, grab the inferior hand, and from here pull through first, and then begin your lift. Take care of yourself. Client rolls onto their belly for prone position. Toes point in initially. When you use your heels, follow the center line of the sole of the foot. Control your weight. Keep some weight on the balls of your feet. Very steady, stable application of pressure. Slow application and slow release of pressure each time. And then when you turn, lift the ankles, turn the feet out, crawl forward, palm walk the lateral line just behind the fibula, alternating, rock from side to side, and then follow into the groove behind the iliotibial band. Then loop to return. Take care of your wrists, don't overdo, come down the back of the thigh, and as far around the corner towards the posterior of the calf as you can. Continue. Allow these presses to roll the leg into a lateral rotation. Then return and relax. And continue. Repeat one more time. Alternate. Checking. Warming. Sensing. And breathe. Thumbing. Take care of yourself. Good alignment. And start behind the malleolus, follow the groove behind the fibula, and again in the groove behind the iliotibial band. It's distinct, you can find it. Then when you reach the top, come inside just below sits bone at hamstring origins, and work your way down the center of the back of the thigh and along the center of the back of the calf. And then repeat. It's a loop. Come up in the groove, just behind the bone structure, behind the ITB, across, and deep pressure at base of sits bone. Return down the back of the thigh. And go again one more time. Thumbing. Breathe. Keep your shoulders above your hands. Sit back to return. And now, right leg first, heel to sits bone. Oh, optional therapy first, that's it. Turn. And when you use your forearm into the lumbar region, elbow is not pointed. Not necessary to jab and point down into the back. Instead, use the surface area on the ulna about 1 thumb distance below the point of the elbow. Allow this bone structure to be like a bar that reaches across a larger surface area. Then also on the buttock, just outside of sacrum. Literally, just along the edge of the sacrum and into the lateral rotators. Again, the elbow is not pointy, does not need to poke or jab. Then alternate your forearms as you walk along the back of calf and thigh. Again, use the flat area of the ulna below the point of the elbow. And then as you roll across the hamstring, Gently allow the muscle to pop underneath the pressure of your elbow, just to relax and to stimulate the flow of energy. Release and stretch heel to buttock 2 or 3 times. Curl the toes at the same time and fold the foot across, park it on the back of the other thigh above the knee. Lean forward to apply the heel of your hand behind the trochanter and along the groove behind the iliotibial band. Take care of yourself, just apply body weight. Easy to do, nothing to do. When you go to apply your knee, fold the foot higher on the thigh and allow your knee to rest on the anterior tibialis. Use the tibial tuberosity. Avoid trying to use the kneecap. Be sure to support your weight on your hands as well. This is not full body weight. And then unload, bring up the other foot, and lift. Bring your body into position. Bring forearm up to lumbar. Don't stress yourself. Allow yourself to reach just the right amount to bring your shoulder over your elbow. Lower your wrist to keep from being too pointy. Then when you move into the glutes, again, keep the wrist low so the elbow is not too pointy. Stay outside the sacral bone structure but close. Work into lateral rotators along the glutes. And then when you go to alternate on the back of the leg, make sure you have adequate support on the lower leg to avoid hyperextension of the knee. Walk as much as you need to in order to get good coverage. Take care of yourself. No need to overdo. Easy to do. Nothing to do. And again, allow the hamstring to move under the elbow. And unload. Stretch heel to same side sits bone. Keep good alignment. Curl the toes 2 or 3 times. And then when you cross over onto the thigh above the knee, left hand reaches out, elbow straight, heel of the hand in the groove behind the trochanter and along the groove behind the iliotibial band. Allow the body to be where the energy comes from, just body weight. And then move the foot higher on the thigh. Bring your body onto anterior tibialis. Regulate your weight. Keep weight in your hands. Keep weight in your back foot. No need to be 100% of body weight. And when you release, bring both feet. Cross the feet. Curl the toes. Switch and repeat. Come around. And here, if you are big and you have a small client, I suggest you think twice about doing this. You want to make sure that you're not resting too much body weight on your client. A good idea for your first time to practice this move is to find someone who's strong, someone big and strong. After this warm-up, which is very, very light, the pressure is light in the back of the calves. Believe me, strong will be too much. And then as you lean back, knees fit nicely into the Achilles tendon. Keep your weight as much on your feet as you can. Use the traction on the top of the feet to make you light as well. It is important to tuck tailbone under. Pelvis must tuck under in order not to be too bony and to increase your surface area of contact. Cross over for a lock. Upper foot is gentle, just enough to isolate the stretch. Nice, reaches into the psoas muscle in the abdominals. And then when you switch sides, just come across. Recross. And go. And again, go. And go. And go. And go. Turn and lift. Step in. Allow your foot to reach well up the thigh in order to give you a good point of balance. A light foot on the sacrum. Still a light foot on lumbar and thoracic. And again, still a light foot at mid-back, mid-upper back. Return. Each time, just let this stretch to reach into the anterior portion of the body. Avoid compression of the low spine. Retreat. And step up for palm presses, twin palms. Heels of the hands far enough apart to protect your wrists. No need to overdo. If you go above shoulder blades, keep pressure light there as the skin will move. Lunge from your body, center. No need to use your muscles. Just warm the back. Warming, checking, sensing. Then when you transition to thumbs, align your thumbs well. Stay in very, very close to the spine. So close that you can actually feel the bone structure as you begin. Then as your pressure goes into the lamina groove, the erector spinae muscle group moves slightly out to the side to allow you to enter into the lamina groove. If you're going to invert your thumbs at this high position, be sure to take care of yourself. Don't stress your thumbs at any time. If you should happen to make your thumbs sore, it can take a long time for your thumbs to rehabilitate and to correct. So don't take chances with your thumbs. This is to stimulate the flow of energy through the meridians. When we go to the shoulder routine, bring the wrist onto your knee. Up on the thigh, retain, and thumbs, again, as close to the spine as you can get in lamina groove. We're not trying to be out on the ribs over the rhomboid muscle. Follow that groove. Stay close to the spine. When you come back up, in order to traction the shoulder, with your left hand, support the rib cage below the shoulder blade. Allow the shoulder blade to float. Reach in front of the shoulder with the right hand. And as you lift, the left hand is relatively light. Simply anchors the torso to facilitate the mobilization of the shoulder joint. Use your body weight as a counterweight. Then switch and drop your knee and pick up the other knee. Wrist comes up, retain, and thumbs close to the spine. Lamina groove. Let your body come over your wrists, shoulders over your wrists. The amount of pressure that you apply is regulated by your lunge. The deeper the lunge, the greater the pressure. Modulate. Then when you go into traction, right hand support the ribcage below the scapula. Allow the scapula to move and float across the ribcage. Reach in front of the shoulder. Traction the shoulder. Lean back. Use your body as a counterweight. Then bring knees centered over the femur at the gluteal hamstring junction as you palm walk the backs of the arms. Reasonably firm but not too strong on the triceps. Stronger if possible on the forearms because it's a very good feeling on the flexor muscles. Regulate your pressure. Alternate by rock from side to side. And then get a good hand hold. Inhale, please. Keep your weight on your toes. Lean back, initial stretch, checking. Move your knees back just about a half a thumb distance. Go again. And for third, again, a small movement back, just an inch or so. Lean, use body weight. Release and retreat. Client turns over. No pillow for second supine position. Bring legs up to as close to 90 as is reasonable for this client. With knees locked, elbows locked. Bring heels over the head. Check the neck for comfort. Inhale, exhale, move into the second stretch. Check, is the neck able and comfortable to take this stretch? And once again, third time, open the spine. Traction, decompress the spine. Elbows must remain straight in order to support, to prevent this from being compressive. From here, drop the hands, open and bump one knee. Cross over. Step in front to anchor that knee as you bring the heel forward. Pre-stretch the hips. Then release that knee and bring up over body towards opposite shoulder. Cross the body, or at least straight up midline. And gentle pressure, hamstring origins. The back leg supports the sacrum or hip. Then as we release, we're simply going to switch to the opposite side. After, we bring the heel in and do foot routine. Bring your forearm in and press into the instep. Traction. Toes towards the heart center. Nice stretch into the calves and Achilles tendon. Then we come in for knee drop. Carefully placed just into the hamstrings, just inside the iliotibial band. You also can peel iliotibial band somewhat. Regulate your pressure. Move your body. Then swap to the opposite crossover. Pre-stretch the hip. Release the knee. Step up and go. Step into support sacrum and pressure gently on hamstring origins as the stretch is applied. Then as we come back, step in front for the lock and come forward for the foot routine. Use your forearm into the soft part of the sole of the foot. Let the foot be stretched at the same time. So we get two things happening. Nice footwork as well as stretch into the Achilles tendon, back of the calf, and hamstring. Step back, come around the corner, and drop your knee. Keep your body over your knee. Articulate and breathe. Make space and drop onto hamstrings for support, and carefully release after each stretch as you move your knees to the new position. It's important that the legs not remain completely straightened out the whole time. It allows for movement into the stretch. We protect and support the hamstring origins during the stretch with our knees. And step back and separate and step through. Knees bent. Client's knees are bent. Bring the feet forward. Feet come together. And as you bend your knees, let those feet come forward and over top of the head, towards the floor, toes towards the floor. Good spinal traction. Then move back and cross. 4. Grab my wrist, please. Inhale. Exhale. Come up. Step back in tiny steps. And come around for seated position. Tip the head forward. Invert your hands. Heels of the hands very close to the spine, close to the neck. As you lunge forward, let the heels of your hands rest into the soft tissue. Avoid the bone structure. Keep your elbows straight. Allow your body weight to simply rest. Gravity is your friend. Gravity helps you through this process. If client's low back begins to slump, instruct your client to support themselves and keep the spine upright. If head comes up, tip the head forward again. Warming, checking, sensing. Into the thumb routine. When your thumbs point up body, be careful, be gentle. Don't assume that your thumbs can do what Pichest's thumbs can do. He's been doing this for lifetimes. His thumbs are really powerful. Take care of yourself. Develop strength over time. Give yourself time to develop. Recognize that you want to stay really close to the spine. Thumbs are directly aligned in line with the bone structure. It's not the point of the thumbs. It's the joint area, the first joint area where the first wrinkle is on your thumb, that makes contact. Take good care of yourself. No need to overdo. Just move the energy. From here, come down and bring up one arm. As you set up, let your primary hand, in this case the left, be a pivot. It's simply a fulcrum. The pulling comes from the right hand, as the left elbow is between the shoulder blade and the spine. That allows that left elbow to press gently down into muscle structure during articulation. Then come up, support the hand, pre-stretch while spine is supported to stretch triceps and lat, and teres major, and then pull gently directly in towards bone structure on the triceps muscle with your outside hand. Then you switch, go to the opposite side, and turn. Support the spine. Your elbow supports the spine. Allow those muscles to feel gentle compression during the stretch. The articulation is primarily what is happening. Then when you come to standing, support the hand. And reach across, stretch, and pull. Avoid skin burn. Pull directly in towards the bone structure. And pounding gently with open hand, hollow fist. Release. And on one knee, tip the head forward. Gently place your forearm against the back of the head. Other forearm rides at that same location on the ulna, about 1 thumb distance below the elbow. A bar rides across the trapezius muscles. Allow your body weight to be directly over your elbow. You do not need to use your muscles. Just keep the head off to one side in a gentle on-stretch mode. It's not necessary to articulate the head at all once you've reached a reasonable range of motion. So in this case, for instance, right forearm is very, very light. Where the energy is focused is into the left. When you squeeze, you lift. It is not necessary to squeeze in on the sides of the neck towards the center of the neck. As we squeeze, we allow the skin to move up and we lift. Squeeze and lift. Squeeze and lift. Just to relax and make nice. Then with the thumbs, gentle lift, fingers interlocked, and then when you go to squeeze, allow a little rotation, a little roll. Improves the lift. Thenar eminence makes contact. And now thumb, center point. Gentle traction, elbow supported. Start at center point. And then onto erectors at their origins. Then in the space between the erectors and the mastoid process, there's a pocket. Return to the erectors and return to center point. To switch sides, change your knee position. Thumb at center point on nuchal ligament. Then erectors. Then in the pocket between mastoid process and erectors. Return. For both hands, Let the thumbs be a flat bar at the occiput, from the mastoid process all the way across to the erectors. Use your knee for support. And then circles. Relax the scalp. Let your thumbs be flat. Fingertips also rub the scalp. Stand up. Fingertips come around and start on the temples and side of forehead, coming up, then across, top of forehead towards the sides. Center line is mid-forehead. Work your way across. Flat fingers, not pointed. Then again, close to eyebrows. Finally, bring fingertips up, bridge of nose towards third eye, and across, gentle pinching of the eyebrows. And then stroke down the cheeks, and then across bridge of nose, down into the space below the cheekbones, and then big broad circles across the ramus of the jaw. Several passes, relaxed completely across this energy line. Then fingers flat on the masseter muscles. Soften those jaw muscles. Big sloppy circles. Not too deep. Just nice and big broad circles. Then flip the ears, flicking the ears. Move the energy in the ears. Meridians and points are there. Stimulate the flow of energy. Bring the hands up and interlace the fingers behind the head. Reach through, close to the elbow. From here, let your right knee be very, very light. And gentle twist, twist, and go. Each time is gentle, checking, checking, go. Return to center. Come up onto your toes, knees very, very close together, close to the spine. And small movements at first. Let your knees move around. Stay off bone structures. Work your way down into lumbar and come back up. Nice extension of the spine. And release those hands. Park them with palms up. Sit down. Feet, one foot between shoulder blades. Edge of foot touches the spine. Work your way down till your foot can flatten between shoulder blades. Then as you continue, let your foot offset to tuck toes underneath inferior medial border of scapula. Then when you switch feet, repeat for the opposite side. So you come back up and then change. Left foot comes up, edge of foot touches the spine. And mid between shoulder blades. Offset to left, tuck in. And then, when you prepare for both feet, bring your feet below shoulder blades slightly so that they're close to center. Lock your knees and then lean back. 1. Come down just an inch or 2. Go again. Return 1 more inch. Extend the spine. From here, walk down. If you're going to do the rack, be careful. I want you to protect yourself. Do not hurt your toes. Practice this. If you're going to practice this, practice with a small person and make sure you do not injure your toes. Rest the head on a pillow. Bring the arms up. Have them grab your back. Inhale, please. Exhale. And then extend your toes. Make sure your toes do not poke. Extend from the ball of the foot as you articulate your ankle to create traction, to lengthen the spine, to decompress the spine. And then lift the head to bail out. Remove the pillow. Come up. For squeezes, lift and drop. Just lift and let the skin drop. Simply relax. Be brisk. Not slow and massage style. Instead, lift and drop. Lift and drop. T pattern across the tops of the shoulders and down between shoulder blades. Soften and relax. Chopping. Just allow the tips of your fingers to be the point of contact. Sides of the hands are much too rough, so allow the tips of your fingers to make contact and avoid bone structure. Brush and brush and brush. And thank you very much. Om Namo Shivago Naa Nawa loka payati vinasanti.